Welcome to Red, White, and Blue. From the right, I'm Gary Polland.
And from the left, I'm David Jones.
Tonight, our guest is Lieutenant Governor David Dewhurst, a Houston native, highest-ranking public official in Texas from the Houston area. So, Governor, thanks for coming.
Well, I'm delighted. Always a pleasure to be on your show.
Okay, well, the first thing I want to talk about is the budget. We just came out of a session. Texas was able to balance its budget. I'll bet we got help from the federal government with stimulus money. We won't have that money in 2011. How are we going to handle the 10, 15, or more billion dollars in shortfall for our budget in 2011?
Well, first let's go back. And one of the things I've tried to do as Lieutenant Governor, and the Senate's gone along and the House has gone along. In the 2007 session, Gary, I saw this coming. I think a lot of us did. We talked about it. So I asked the Senate to save $9 billion, and the House went along. So because of that $9 billion of saving, when the comptroller in January of this year cut our revenue estimate by $9 billion, we weren't flat on our back. So that's why from day one we were in the black going into this legislative session. Now, we didn't have new money, and the stimulus dollars helped us with new money. We would have been flat as far as our spending. But going into the 2011 session, our best guess is that we're going to be running somewhere in the neighborhood of a $9 to $10 billion deficit. That's why, once again, I insisted that we save right at about $10 billion. So we'll be able to pay off that deficit. We'll have a little bit of additional money. Hopefully we'll see some growth in our budget so we can put additional funds in for not only our public education, higher education, roads,
Let me ask you this,
social services.
Was it wise to eat up the dedicated funds that I read about recently that were set aside for help, uninsured trauma care? You had low-income utility bills. They had dedicated funds to help low-income folks with that. All of that dedicated money, $3 billion, I think it was, in the fighting air pollution, emission controls, and things like that, gone. Did you have to do that?
No, well, actually, they're not, David. They're actually not gone. We still have some balances in almost all of those accounts. We funded hundreds of millions of dollars on improvements in our air quality. We passed important legislation by Senator Averett to improve our air quality. We passed additional reductions to help poor folks pay their electricity bills. And so we funded a number of programs. We cut the diversion, if you may, of our transportation dollars to DPS, which is a completely legitimate function, but we cut that by about $325 million.
So Mr. Turner said that basically, you're not denying that some of that money was absorbed into the general fund. Some of those dedicated funds was absorbed into the general fund budget of the state of Texas. Sylvester Turner basically said in this story that you're just the legislature's misleading people. It's really a tax, and you ought to tell people.
Well, what we're trying to do is, and we started this session in 2009. It's going to take us a couple of sessions because the legislature's been doing this for a long time. They've been holding certain balances on dedicated funds. I've been a proponent of helping folks that need a safety net. I've been a proponent on helping to champion not only public education but higher education. And so those funds are there. But again, we went into the session, we would have been in the black regardless of the stimulus funds. But when we laid out our budget, because we saved $9 billion between 2007 and 2009, based upon what we wanted to spend, we were $4 billion short. So since Texans were paying for those stimulus dollars in additional taxes, we took those funds down. And that way we were able to put new money into public education, new money into higher education. We were able to make huge improvements in our Medicaid funding, provide more coverage because more people now, because of the recession, are needing Medicaid.
I didn't hear a thank you to President Obama, though, for that extra money. Did you? Or did you write him a letter and say, way to go, Prez?
No, but I did say thank you to his staff.
Okay.
We've talked about the session, this last session. Right. I want to hear some of your disappointments from the last session, of what things you really wanted to get done you were unable to get done.
Well, first of all, I think people can be proud of the fact that we had a good session. We had a good session in 2007. We had a very good session in 2009. We got a lot of very, very important legislation passed. One of my disappointments was that after the House had passed it twice, this year the Senate came together. One of our first pieces of legislation which we passed was voter ID. I mean, voter ID is something that shouldn't be a partisan issue. Overwhelmingly, virtually everybody, the vast majority, believe that you, in the sanctity of one person, one vote, and that you ought to have some identification if you vote. I mean, you can't get on an airplane without a photo ID. You can't check out a library book. You can't buy Sudafed. So we passed that in the Senate, and unfortunately, it didn't pass in the House. But I'm proud. In the Senate, in the House, working together, we passed a good budget. We held the increase to only 2%. I insisted on putting $500 million into the budget for job retraining. Now, over the last 2 or 3 years, Texas is leading the country in job creation, but obviously we're not immune from the recession. So we've got people out of work, so we want to make sure that they're retrained. We're working hard to create new jobs.
You know, Debbie Riddle, the state rep from Houston, she said the session was a complete failure as far as she was concerned in terms of social conservatives and what they were after. Mandatory sonogram, pro-life plates, and of course the governor's appointment to the Higher Education Board was defeated. Total failure. Didn't she say that, Gary?
She did.
Your reaction,
She was
please.
disappointed. Well, it was the State Board of Education chair
right.
who didn't pass.
Well, with all due
the Senate.
respect to Debbie, and we passed those items out of the House, out of the Senate. So there is a bicameral system. All I can do is, but we passed the sonogram, which wasn't mandatory, but it gave a woman the opportunity to listen to that heartbeat. And we passed out the license plates out of the Senate. So
she'll have to run for the Senate then, it looks like.
Well, no, or get more Republicans in the House because the numbers are so close. Okay, medical care. I know that you've spent a lot of time in study in this area. It's a very important area, but I guess and we're gonna now talk about that. Obamacare. If Obamacare passes, what is the impact going to be on Texas, and is it positive or negative?
Horrible, negative. The numbers that have just come out of the Health and Human Service indicate that Obamacare will cost us here in Texas, in state dollars, general revenue, not federal dollars, between 11 and $17 billion in the time period between 2013 and 2017. Roughly $2.5 to $3 billion more each year. And on top of the growth in our enrollment, we'd be talking about $4 to $5 billion, $4 to $6 billion a year, $8 to $12 billion a biennium. Gary, David, that's unsustainable. That is totally. I've been talking about crowd out. I've been talking about we've got to reform Medicaid. We've got to reform our health care system. But we're seeing it now. We're seeing crowd out. We're seeing reduction in our funding, which we could have been able to make in public education, higher education, highway spending, because of these dramatic double-digit increases each year in Medicaid. And, of course, the same thing is true in the federal program, which is Medicare. I've spent a lot of time over the last 2 years. I passed out of the Senate Bills 6, 7, 8, and 10. Long story short, we could devote a whole program to this, but it's fascinating. Okay, we all want health care is about people, and we want all of our friends. We want Texans. We want Americans to be healthy. We got the greatest hospitals, the greatest doctors in America in Texas, but we spend almost 2.5 times more per capita on health care, 2.5 times more per person in America than the average of all the other 29 developed countries.
And we still leave out 47 million people.
We still leave out 47 million people. And, David, our outcomes in a lot of categories, our results are not as good. Why? Everybody else pays for wellness, prevention, best practices, and outcomes. We don't. We have a system in which we pay hospitals and doctors based upon how many procedures they do. We've turned our doctors into entrepreneurs. There's a with total respect, okay, I'm a proud Republican. I agree with President Obama that we have a problem with health care. We have a crisis. I disagree respectfully with his solution. I think there's a common sense solution where we have enough money in the system to cover the 47 million people, to pay our doctors and our hospitals fairly by focusing on quality, not the number of procedures. Let's align the interest of our patients, our doctors, and our hospitals. That's called clinical integration. Let's get them focused on best practices. Let's get them focused on paying for an episode of care, bundling. Let's get them looking at working together and providing really good care.
This all makes a lot of sense. Except
it works.
I mean, I couldn't agree with you more, except there were going to be folks like Gary who are going to say, they hear a hint of rationing of care in your argument there.
No, just the opposite. The rationing of the care comes in the government program, not in a private program. What I'm saying is that let's use best practices on people. For instance, there was an article in the New Yorker in June. Interesting comparison.
About McAllen and how much money they're spending.
That's right. McAllen versus El Paso.
Right.
Same demographic, same population. McAllen spends $15,000 per Medicare patient. El Paso, $7,500. Same health outcomes. Why? Because you've got a lot of doctors which own imaging facilities and things of that nature.
Apartment buildings.
Okay. But no. I'm not carrying anybody's water. My father-in-law is a doctor. My brother-in-law is a doctor. Well, but we've all got to come together and reform. Doctors and hospitals are coming on board and saying, at the end of the day, we don't have health care in America. We have sick care. Let's keep people healthy. Let's keep them out of the hospitals. Let's use best practices. National numbers show only 55% of we got the greatest doctors here in Texas. They're probably all here in Texas. But nationally, only 55% of our doctors use best practices.
Well, we have to pay more money is going to have to be put into this system until we get the controls on the practices you're talking about.
You're going to have a transition. Admittedly, you're going to have a transition.
And is the public plan, is that not a way to force the insurance companies who are now dominating this field now for the most part to compete so that they can bring costs down? 100 million consumers, including Medicare, Medicaid, and the uninsured who could buy into the public plan could drive the costs down.
David, let me give you some data points. We're spending here in America about $2.5 trillion a year on health care. Dartmouth has done study after study, Rand Corporation. A third of that is ineffective. Okay? That's $800 million. We've got enough money in the system to pay our doctors fairly, our hospitals fairly, and do either or both. Lower the 10 to 15% that all of the 83% of us in America who have some form of health insurance, the premiums. And on the 17%, the roughly 47 million people who don't have any health care, to be able to help them to provide care, preferably through private plans.
Should the way that this problem is addressed should be done by the states and the federal government just kind of like butt out and let the states figure out how to do it? Like we could have the Dewhurst plan in Texas.
Well, we could
try it, make it work.
Well, the Dewhurst plan's already working. I mean, we have pilot programs in which these principles are working. We're getting better outcomes at less cost. But at the end of the day, you're going to have federal legislation to modify not only Medicaid and Medicare, but to change the way that doctors and hospitals are paid. You got to get away from paying for quantity and get back to quality. I mean, it makes no sense on these,
This sounds like the Senator Dewhurst plan to me. I mean, there is no state total takeover.
You mean as opposed to the Governor Dewhurst plan?
Yeah, that's right.
Well, actually, it's a little bit of at least on substance both, because I've been concerned about this. I've been talking about this for 5 years. That we're going to have to see the reforms. I don't see people. I see people talking about this in Washington, but no action. Here in Texas, we've got a pilot program in Star Plus. In 3 of the 4 bills on health care that I passed out of the Senate this year, and which passed out of the House Public Health Committee, and we were able to tack on at the last minute provisions of these bills on different House bills. But what we're doing is we're forming pilot programs that do just this, that focus on best practices, reduce cost, have integration, getting everyone aligned on the same side.
So your advice to President Obama is take a deep breath and take your time. There's no rush to do it wrong.
Absolutely.
What about the leadership of the state of Texas and your part in that, and its future, and the future of the Republican Party, which Gary is interested in? Senator Shapley of El Paso has a book out, and it has us, state of Texas, at 49th in teacher pay, 41st with high school graduation rates, 46th at SAT scores, 50th in the percentage of 25-year-olds with a high school education. Now, what do you do to make this state secure with those? How can you make it secure with those numbers?
Well, first of all, Senator Shapley is a friend of mine. I quarrel a little bit with some of his numbers. We've continued to put more money into public education. We've dramatically raised our teacher pay. Our teachers right now, on average, are paid some $46,000. Now, in a perfect world, would we attract we've got some great teachers. Would we attract even more good teachers to go into teaching if we could pay them a little more? Sure. But we've had some real challenges. We're going to have to reform health care to free up literally billions of dollars that we can spend on not only our public education, higher education, more roads, cleaning up the air, things
So
of
it all
this
goes
nature.
back to health care.
So
Okay.
yes.
I wanted to talk about politics. David did mention the future of the Republican Party. 2002, the Republican Party basically locked down every statewide office. We had solid control in the state House, solid control in the state Senate. And if you look at what's happened over that time, at least in the state House, we've been hemorrhaging Republicans, such that this last session we had a 2-seat majority, which is not much in the House, which is a little unruly, as we know, unlike the Senate, which is behaves more often, I guess. So what is that saying about where the Republican Party is today, and what do we need to do to get the Republican Party back to where it was dominant in both houses of the legislature? And then maybe lessons for the nationally Republicans.
Well, first of all, take a deep breath, everybody. Okay, remember, we're doing pretty good here in Texas. In a perfect world, we would want to make Texas the one state which is completely immune from the recession, but that's not possible. We're still leading in job creation. Our unemployment rate is 2% below the national average. We got a lot going for us here in Texas. We're bringing in new companies, thousands and thousands of new jobs. I'm proud of the Republican leadership that we've had for many, many years, certainly in the time period which you were talking about between the 2002 election and today. I think we've had good leadership. We've got a lot accomplished. If you have a half hour, I can walk through the list. But you know, Mark Twain said a long time ago, the news of my demise is greatly exaggerated. Let's go back in November 2008. You had the most charismatic, you had the number one Democrat rock star on the ticket, Barack Obama. And here in Texas, John McCain beat him by 12 points, 56-44. Now, every statewide office is held by Republicans. We didn't lose any statewide positions in 2008. We've got a majority, solid majority in the Senate. We still have a majority in the House. I think, although I don't have that much time to follow our House races, but when I look at not only midterm elections and the candidates that are talking about running, I think we're going to pick up seats as Republicans in the Texas House, and so I feel good about that.
The problem, Governor, is with Hispanics, of course.
Yes.
And they went with Obama probably 65, something like that, % last time. And your higher education commissioner, Paredes, says that Texas is failing Hispanic kids. I mean, he's a story today in the paper. We are not a high-achieving state for education overall, and even less so for Hispanic kids. And those voters are waiting for the message as to how you get their kids, keep them in high school, and get them into college.
Well, David, with all due respect, that's not exactly what he said. What he said was in Closing the Gaps that although we've had dramatic increases in both Anglo, African American, and Hispanic, growth in our universities and our colleges, there has been a drop off. There hasn't been a continued increase in the Hispanic.
You need 300,000 enrolled
That's right.
by 2015.
That's right. Which is a goal that was set a number of years ago. We're going to all have to work harder in order to get more deserving students. One of our chancellors, Kent Hance at Texas Tech, every Sunday night will get on the phone and call deserving, bright African-American, Hispanic kids, trying to get them involved and go to Texas Tech. Bob Gates, when he was president of A&M, was doing the same thing, was reaching out. And so, sure, we need to get more deserving youngsters in college.
You think that's why Kent Hance picked Alberto Gonzalez to be a teacher and paid him $100,000 to recruit? Is that a good expenditure of state funds?
I have no idea, but we put billions of dollars into not only over the last 4 to 5 years. We've made huge investments, billions of dollars in health care, in public education, in higher education along the valley, in South Texas. I was Mr. South Texas in 2007. I'm down there all the time. I'm on radio shows, TV in Spanish, reaching out. It has nothing to do with David Dewhurst, but reaching out and trying to get people involved and to graduate from high school and to go. We just made a dramatic increase in our Texas grants and our Be On Time program so we can shoehorn more deserving students into college.
You probably speak Spanish, too.
Yeah, I did. Well, I used to live
I see.
Okay, well, let's talk about politics. 2010 is a political year. There's lots of high-profile races. It appears it's not certain. There could be a U.S. Senate vacancy in a special election. There'll be an appointment by the governor. There's a governor's race. There's a lieutenant governor's race. Does David Dewhurst know where he's going politically?
Gary, right now, there's no opening in the U.S. Senate. I enjoy being our lieutenant governor. It's a great job. It's unique from almost all the other 49 states. We get a lot done in the Senate. I'm proud of our senators. They're friends of mine. So I enjoy being our lieutenant governor, and I plan on running for re-election. If, in fact, our senior senator were to resign before the end of the year, then I'd take a very, very serious look at it.
You don't believe her when she says she's quitting in October?
Well, David,
Bill White was here. He thinks she's quitting, and in fact, he's the conservative in the race because he said that when asked,
funny.
"Are you going to end?
That's
Don't
funny.
ask, don't tell?" as a U.S. senator, he says, "I'm going to leave it to the generals." When he was asked, "Will you support a ban of the importation of assault weapons?" he said, "I'm for the Second Amendment."
Do you want me to?
Okay,
do you want me to answer your question,
sure.
or do you want to talk about Bill White?
Well, he wants to run against you.
Well, he may have the opportunity. There's not an opening right now. Senator Hutchinson has said on a couple of occasions that she's thinking about stepping down in October or November. But at the same time, she said, I can't be stepping down if we're right in the middle of the health care debate, if other things are going on. So I don't know. If, in fact, she steps down, then I'll have to make a decision as to what I think I can do, which is best for Texas. And we've got some serious challenges in Washington. I mean, international policy, energy, our budget, education, health care. And all these are areas that I've spent a lot of time, worked on over the years, been on presidential commissions, been in the energy business, conservation, been a champion here in Texas on public education and higher education, and probably today know more about our health care and reform than anyone else I know of.
And you too would leave "Don't Ask, Don't Tell" to the generals, I would take it.
I would ask this question, Governor. If there's a resignation and there's a governor's appointment, is it going to be a requirement for you that you get the appointment to run, or you just make your decision on whether or not you think it's the right time for you to step up?
Well, I think we all try and step up every day. I don't know that I don't know that it's stepping up to go to the United States Senate. I happen to have. I really think being lieutenant governor is a very unusual job.
How about a step in a different direction?
A step in a different direction.
Nice amendment.
Gary, I think where I am is I'm going to make a hard decision as to where I think I can serve the state of Texas best. And if I believe I can serve the state of Texas best in a time we've got some real serious challenges internationally, budget, as a businessman, having been hands-on solving our budget here in the state, energy, education, health care, if I believe that that's where I can do the best job, then I'm going to get in and I'm going to do that.
Your
do
way.
all I can. I'm going to do all I can.
And he did
to
it,
win.
and you did it for us, and we thank you for being here.
Well, you're very
We're
kind.
sorry to
Thank
say
you.
go, but we have to. And y'all can follow up tonight's discussion if you go to HoustonPBS.org and look at Red, White, and Blue there, so check that out. And until next time, get informed and get active.